The point-of-care healthcare technologies are those devices or the protocols that the patient can use with minimum or no interaction from the physician and healthcare provider to acquire the data that is of clinical use and significance. So for example, if there is a mass screening of the infection, so something like bird flu or HIV virus, breaks out. Since everybody in a society cannot be seen by the physician at the same time, the people could have this little device with the biomarkers associated with it to actually test themselves. Now, in many cases, this is not a new concept. I think a little strip for the pregnancy test can tell a woman whether she is pregnant or not in the comfort of her home was the first most successful point-of-care healthcare technologies. Right? The second is this blood glucose meter. Of course, it requires a drop of blood, and sometime the patient feels pain about it, and they may go out of compliance and not using it. But that is another example of point-of-care technologies. Now, from patient to hospital, the entire spectrum is not a one-step change. In today's society, there are, from patient home, there are nursing stations, or in today's society, there are web-based resources. Then there are urgent care facilities or the healthcare providers' facilities in their offices. And then there are the hospitals and emergency care units. So the point-of-care technology is actually a common thread from the patient home to the healthcare provider facility, whether that particular facility is a nursing station or that facility is an emergency care unit or intensive care unit. So the point-of-care healthcare technologies not only can be used by the patients in the comfort of their home for regular monitoring, but they can also be used as a quick test in the mid-healthcare facilities, such as the physician's office or nursing stations. So I think that the first step in that particular direction is bringing people from all sectors and from all parts of the globe together on the same venue. So we need to learn from each other what are the challenges in developing economies versus developed economies in better patient health care. We also need to understand what are the difficulties with respect to the cost, with respect to deployment, with respect to patient acceptance of these point-of-care healthcare technologies in developing countries versus developed countries. So even though the common thread is better, affordable, quality healthcare, but the mechanism to reach to that particular goal is based on the social environment, is based on the local economic structure, is based on the local infrastructure to provide the healthcare facilities, and also in terms of some psychological and the emotional factors. People get surprised when I tell them that the healthcare cost in Japan is less than half of the healthcare cost per capita in United States. But the life expectancy in Japan is significantly higher than the life expectancy in United States. So that tells us that simply providing a costly quality healthcare cost is not the solution. So there has to be a patient education and the patient role that has to be redefined in preventive medicine and personalized medicine that will improve the quality healthcare. Well, the thing is that right now there is an awareness that has started to make an impact in the healthcare. This particular attendance in the first IEEE Point of Care Healthcare Technology Conference is the proof of that. Many of the medical devices companies are now looking into manufacturing the devices which are point of care technology related, and that can be brought out to the patients at a lowest possible cost. Now, as I said before, that diabetes is one of the major global healthcare concern. Hypertension is a major healthcare concern. Even though in developed economies we talked about the cancer, which is a global concern, but the cancers do not come in the same serial order as they appear, the causes of death in developing countries versus developed countries. For example, in developing countries, the lung cancer and the oral cancers are on the top of the list. In developed countries, breast cancer and prostate cancers, they are on the top of the list. So when we look across the globe, we will find that the specific critical needs are different. And they are based on geo-environmental risk factors, they are based on socioeconomic conditions, and they are based on the lifestyle and the personal beliefs in that particular society, which are very different. So therefore, in order to create a strategic planning, we need to bring everybody together. We need to look into more globally, in the sense that, okay, for one part of the world, we may be requiring that HIV is the most significant issue to address through point-of-care technologies. On another side of the globe, we may find the infection diseases or malaria is the topmost cause that we need to work on it. On other side, there may be hypertension, strokes. They are the one that we need to address more. So I think this is also one of the challenge, because there's not one single area that you can just put all of your efforts in there. There is a complete spectrum, and we need to work in each one of those areas. It is very important to identify some of the critical diseases before they get to the point where they are either incurable or they are very difficult to manage clinically. Now, whether they are related to the HIV viruses, immune system, or they are related to neurodegenerative diseases, or they are related to infectious diseases, it is very important to produce those low-cost devices with biomarkers so that the people can scan themselves and provide the data towards early symptoms of critical diseases. So if I have to give a message and a challenge to biomedical researchers, that would be to create these biomarkers for the specific diseases for early diagnosis. Now, again, as I said, this is a general statement, and general in the sense that there is not one single global healthcare challenge that can be identified and say, okay, just work on the hypertension, or just work on the diabetes, or just work on the HIV or infectious diseases in there. It is a spectrum of those illnesses, because their priorities and their impact in their respective societies are different. I had a great fascination about the technology. the other thing was there that I also saw the healthcare concerns all around me when I was growing up, in my family, in my neighborhood, and I saw people suffering a lot. And I also saw that the people not being taken care of because of their personal or the social beliefs or the socioeconomic restrictions and limitations. So even though I started my baccalaureate degree in electrical engineering and computer science, I wanted to get into the field of medicine, and this is what I did at the graduate level. And at that particular time, when I started using non-invasive optical technologies and proposed a mass screening device for skin cancer detection, the people thought I was crazy. But as I, as I looked into those concerns, it was clear to me that the only way to make the practice of the medicine better and to provide a better health care is using more and more technological tools. It was clear in 20th century in radiological sciences that computed tomography, MRI, ultrasound made a revolutionary impact in the field of medicine. So now it makes perfect sense to extend those technological tools towards the patient so that the gap between the patients and the clinician becomes shorter. And not only shorter, it becomes a communication channel, two-way communication channel to provide the best health care.